Welcome back, everybody. You know, the wait time in hospital emergency rooms is at an all-time high. Millions of Americans, they can't afford health insurance. What do we do to ensure our family receives the best care? Well, our next guest has some answers. He's the author of The Best Health Resources on the Web and the director of the Intensive Care Unit at Northern Westchester Hospital in New York. Please welcome Dr. Harlan Weinberg to the show.
Hello.
Doctor, welcome to the show. Thank you. So, in your book, you actually dedicate the book to the memory of Dana and Christopher Reeve. You say, for whom there were no immeasurable or insurmountable obstacles. So they were very close with you.
I knew Dana and Chris very well, and the challenges that they both faced during their lifetime were inspirational in how they handled it, what they did with their lives, how they affected other people's lives outside of their own family. And I think for me, on a personal level and a professional level, it was a wonderful experience working with both of them.
He's a survivor. I want to talk a little bit about switching gears just a little bit to Glenn Beck. If you know the story, he was a gentleman who spent we all have awful experiences in emergency rooms.
Yeah.
And Glenn Beck was one of those individuals that had a terrible experience. He had a case that he went in for and ended up spending hours in the emergency room. He claims to nearly have committed suicide because of the medication that he was given. And we wanted your personal opinion about the circumstance and sort of what's going on in emergency rooms today.
Well, I think the general comment that can be made is that emergency rooms and hospitals face an incredible challenge on how to improve the ability to handle larger numbers of patients that they're seeing and lower numbers of emergency rooms that are available for patients to go to. And this is compounded by the fact that there may be less staffing, not only nursing but physicians, as well as bed space availability within hospitals to get patients moved from the emergency room into a regular hospital bed. And I think, you know, the story is not an unfamiliar one. I think it is seen across the nation. And hospitals are trying to take steps to improve patient flow from when you first walk in the door, getting registered, being seen, and then getting discharged either to home or to moving to a hospital bed upstairs. It's a big challenge. It's going to take time to fix, but I think people are working on it.
So what can we do then? If you walk into an emergency room and you need care, is there something that we can say or do to get better care? Is there, you know?
Well, I think from a patient standpoint, it's very frustrating when you have to wait. And I think that everybody who goes to an emergency room feels that their problem is the #1 problem that the emergency room has to handle. I think be patient, speak with the people that are there, express your concerns about what you feel is really important to you as far as getting those issues addressed. And be cognizant of the fact that things don't happen in a minute.
Well, I think a lot of people are also taking, because of what's happening in the situation, they're taking responsibility and they're turning to the internet for resources and sort of almost self-diagnosing, right? And that's what you're here for, because you've written this fabulous book called Best Health Resources that kind of helps us navigate. Is it a good idea to go to the internet?
I think it's a good idea from the standpoint that it's part of the puzzle for you to look for health resources. It doesn't replace your physician, and it shouldn't replace your physician as far as you going there, having a visit, having a doctor-patient relationship, and discussing your health problems. I think for patients, there are different places you can go to get varying levels of information. Most general to things that are very specific and technical. And I think with the number of people that are using the internet today, and the internet being at everybody's fingertips, access to healthcare information is a growing part of what people use it for.
So not only are we getting access to information, but on the internet we're getting access to the drugs. And I know a lot of, especially seniors, they're now buying their prescription medication online because it's cheaper. And is that a safe move?
It's not a safe move. I think that you have to be able to purchase your medications from reliable distributors, knowing that the medicine that you're ordering is the medicine that you're going to get. And there may not be good standards for medication safety and accuracy of the pills that you're getting online. Even though it may be saving you money, in the long run, it may be dangerous to your health.
Just very quickly, can you name some of your favorite websites?
Well, I think there are a lot of websites, but I think a few of them that are very good include eMedicine, which is a great clinical site. It's mostly a professional site, but I think for interested patients, it's user-friendly, very easy to read. Up-to-Date Online offers a patient section as well as a professional section. The professional section is for subscription. The patient section is free. And there's another section done by the government called Medline Plus, which offers a innumerable number of clinical conditions, information on medications, where you just find what you're looking for, click down the links, and you can access a variety of information on multiple topics.
Well, Doctor, thank you so much for coming on the show. This was some very useful information. If you'd like more information on Dr. Weinberg's list of medical websites, visit us at intheleop.ivillage.com. Later, we're playing the Fatty Melt game, so stick around. And we're cooking up something delicious in the kitchen.